For example, we have antibody and adaptive immunity, and they are specific for a specific antigen.
Yes.
And for example, SQ, it's not a figure, one specific bacteria or virus. All the microorganisms, skin can defend against them.
Yes, exactly. So, in innate, it is also called natural or native immunity. We have cells and proteins, for example, cytokines that are always present. For example, what are the parts of immune system, innate immune system? For example, the first one.
White blood cells.
Which kind of white blood cells?
Lymphocyte,
Lymphocytes are part of adaptive immunity because they are specific against antigens.
Yes, this is antigen. For the innate, we have macrophages, the dendritic cell.
Yes.
And
for example, macrophages. The things that you learned in the part inflammation. It was the second chapter. Yes. Inflammation is part of innate immune system.
Polymorph our cells.
Yes.
The white cell is part of innate immunity.
Yes. So the first step in defending against microorganisms is innate immune system. Yes. So they are always present and they are activated immediately and are the first line against the microorganisms. Yeah?
yes.
And as you recall from the chapter inflammation, they are not only active against microorganisms, but also they are active in clearing the damaged tissue, for example, the necrotic tissue. But when we are talking about immune system in this chapter, we are mostly talking about infectious agents. Okay? And we have adaptive, acquired, or specific immunity, which, as our friend said, it is specific against a different type of antigens. For example, we have this type of lymphocyte which produces antibody against a specific type of antigen. So the first line is innate immune system, and we have activation of adaptive immune system most of the times after 3 to 7 days. So both these systems are important in defense against microorganisms, and disorders that involve each part of the innate immune system or adaptive immune system lead to immune deficiency. Okay. So about innate immune system, we have
natural killer macrophages and dendritic cell.
yes. As you recall from the chapter inflammation, we have phagocytic cells, which are neutrophils and macrophages mostly. And what was the difference between neutrophils and macrophages?
Their half-life, for example, macrophages more than neutrophil, and also the ability of the phagocyte is macrophages can phagocyte bigger debris or bigger particle of something than the
Yes, and an important difference is that neutrophils are part of acute inflammation, and macrophages, yes, they are part of chronic inflammation. So we have phagocytic cells, we have epithelial barriers, which are the first barrier against microorganisms, skin, mucosa, yeah? And we have dendritic cells, natural killer cells, and we have plasmaproteins, such as complement system, as you know. Okay, what do you see in this picture?
the innate immunity and adaptive immunity.
Yes, We have epithelial barriers, we have phagocytes, dendritic cells, and NK cells, and complement system. For example, here we see that we have
Pathology.
phagocytic cells, yes. We have neutrophils and macrophages, and they have a specific receptors. Of course, I cannot say that they are specific. They are receptors that recognize some patterns that are, common in different microorganisms. Okay, so we have receptors, and we have, phagocytosis of the microorganisms by these cells. We have dendritic cells, which are antigen-presenting cells. We have NK cells that directly kill the infected cells, which are mostly infected by viruses. Yeah, NK cells are active against viruses, and we have complement system. And here we see adaptive immune system composed of B lymphocytes and T lymphocytes. What's the difference between B and T lymphocytes?
The lymphocytes have antibodies,
Yes.
but T cells have receptors.
B lymphocytes, by differentiation, plasma cells are produced and they secrete antibodies. Yes, and they are active in humoral immunity. But T lymphocytes, after dendritic cells present antigen to them, they
Cellular immunity.
start to produce cytokines, and sometimes, for example, they kill the infected cells directly. We are going to talk about them later. And as I told you, first we have innate immunity, and after that we have, after 2 to 7 days, we have action of adaptive immunity. Okay, how do phagocytes recognize microbes?
Pathogen-associated receptor, node-like receptor, and we have RIG.
We have
RIG.
yes, a type of receptor which is intracellular is RIG. Yes, so we have 2 important types of receptors: toll-like receptors and node-like receptors.
As in goat.
Yes.
Node-like receptor as in goat.
Oh yes, yes, exactly. Okay. Here you see that we have different types of receptors in innate immunity. Here we have toll-like receptor. Toll-like receptors can be both extracellular and endosomal. Okay? And we have also node-like receptors, which are located where? In the cytosol. Yes. And toll-like receptors recognize which type of antigens.
But on the cell membrane, I think that they are located.
Most of the time, yes, they are extracellular. Sometimes they
Bacteria?
can be in endosome.
Yeah, like no.
Yes, and node-like receptors are in cytosol. So, toll-like receptors are, we can say that, located on a membrane. Here and here
So can
on, plasma membrane.
we recognize extracellular bacteria?
Hmm?
Bacteria can recognize bacteria.
Yes, bacteria, yeah.
And node-like receptor can recognize viruses.
Viruses, yes, exactly. Among the infectious agents, it can recognize viruses. And it can also recognize, as you told me,
Bacteria.
uric
And yes,
acid,
uric acid. And glucose.
reduced potassium level, ATP,
Yes.
and the products of cell damage. Yes? So, we have 2 important types of receptors: toll-like receptor and node-like receptor. And recognize, as I told you, some motifs that are common against different types of microbes, yes? And after that, what do? They produce cytokines.
Yes.
After activation of toll-like receptors, they produce cytokines that are important in inflammation, and also they may produce interferons which are antiviral.
Or inflammation.
Inflammasome, yes, it is mostly important in nut-like receptors.
Yes.
Yes. And about nut-like receptor, as I told you, they recognize products of necrotic cells such as our friend said, in gut, uric acid, and also increased ATP and loss of potassium, and also some microbial products such as viruses, as you told me.
Cause chronic fever.
Oh yeah, I know. FMF, for
Yes.
example, familial Mediterranean fever. Yes. In all the chronic inflammatory syndromes in which inflammasome is active, because not like receptors, act with inflammasome. After we have attachment of antigen to, of course we cannot call it antigen exactly, the product of cell damage or microbe, okay? To not like receptor, we have activation of what? Inflammasome. And after that, caspase, yes?
Yes.
And after that, we have activation of interleukin 1, which leads to acute inflammation.
But caused by mutation in gain of function.
Mutation in gain of function, okay? Causes what?
Causes the chronic fever.
Yes, I know what you say. You say that chronic fevers in which we have persistent inflammation have gain of function mutations in this mechanism. Yeah. You will learn about that at the end of the chapter when I think Dr. Khazali will talk about amyloidosis for you. There you will learn about it. Okay, so what happens after activation of innate immunity? We have
Cellular immunity and human immunity, right?
no innate immunity.
Innate immunity, we have antiviral defense.
Yes. The most important one is inflammation. Yes, you remember that after a microorganism enters the body, we have inflammation.
But macrophages also do inflammation.
Yes, because they are part of innate immunity. Yeah. Yeah. And also we have antiviral defense, and also we have
Adaptive
innate
immunity.
immunity is important in the stimulation of adaptive immunity. Yes. Okay. And what are the types of adaptive immunity for humoral and cellular? What is humoral immunity?
It relates to the
New one. Humoral immunity.
For example, lymphocyte, one cell, but for cell immunity, it's T cell and B cell.
T cell.
Yeah, cells.
Cell-mediated T cell mostly, humoral T cell. And in humoral we have yes, exactly. They are mostly active. Yes, exactly. So in humoral immunity we have B cells, plasma cells, antibodies. In cellular we have T cells, T helper, T cytotoxic, and we have production of cytokines or cytotoxicity and things like these. Okay.
So DFS cell is active with phagocyte.
Yes, I will talk about that. By producing cytokines, yes. It helps. Most of the times it helps others. For example, phagocytes, eosinophils, for example, production of IgE. Yes.
Yes.
So it is, as we can understand from its name, it is helper. Okay? It helps by mostly producing cytokines. Okay?
And what about the TH17? It's also helpful?
TH17. We are going to also talk about it. Producing interleukin 17, which activate neutrophils. Yes. These are repetition, yes, because you had them in inflammation. Yes. I think you remember. Because I teach inflammation to students of September University.
Oh,
Yeah.
so that's why talking is so good.
Oh,
We want the September t-shirts there.
September. You don't know which university is September.
We know.
You know?
Most great t-shirts are there.
No, teachers are teach here and September at the same.
But they pick the best one for September.
No.
Come on, I saw the September t-shirt. They was amazing accent.
Oh.
The accent is here.
Oh. No, I don't know. Where did we see the September teachers, by the way? You were in Kerala?
No, I talk with them so often. We don't have each other.
You have friends.
So many friends with them.
Are you from Iraq?
Yeah, well, you know.
No?
Yes, I'm.
Oh, yeah. Yes, I went to Sultan University in Karbala 1 month ago.
No, that's not good.
Yeah, and it was a very good university, well equipped.
And expensive.
Expensive! Really?
Yes.
Oh, so I didn't know
I'm
that.
spent money there instead of spending it here.
Yeah, that would be a good thing.
I knew nothing about these things. They only told me you should go there and teach, and I went there and I started teaching at 8 o'clock and finished at 5 p.m. Very comfortable. Yes. Okay, let's continue. So, what do we have in adaptive immunity? What are the different components of adaptive immunity? We have lymphocytes and we have some APCs, antigen presenting cells, which their job is to present, they capture the antigen, they process it and present, the antigen to different lymphocytes in this system. Okay, here you see an overview of adaptive immunity. What do you see there? You see a B lymphocyte, and you see that after interaction of the lymphocyte and antigen, it differentiates into plasma cells. And plasma cells produce and secrete antibodies. And by producing antibodies, they neutralize the microbes and they perform they're important in phagocytosis. Why are they important in phagocytosis? Can you tell me? What is the act of antibody that is important in phagocytosis? Opsonization, yeah? Do you remember opsonization? Attachment of some molecules to antigens, which make the antigens delicious for the phagocytes, yes?
Yes.
So antibodies are important in phagocytosis, and they activate the complement system, and that's why they are also important in, they act against microorganisms. And we also have T lymphocytes, helper T cells, which, after the antigen is presented to them, they produce cytokines, and by producing cytokines, they activate the macrophages, and they are important for activation of inflammation. And these cytokines also cause, proliferation and differentiation both of T cells and B cells. And we also have cytotoxic T lymphocytes. Why do we call them cytotoxic? Cytotoxic.
Because they intoxicate the cell.
Yes, they directly kill the cell. And what are the types of the cell? Which cells do they kill? Tumor cells
The effect is a virus.
and yes,
The cells that
infected
were
by
affected.
viruses. Yes. So do you remember the mechanism of apoptosis? The extrinsic aspect. Yes.
Cytotoxic lymphocyte
Yeah.
and still reacting lymphocyte.
Yes, exactly. So in cytotoxic T lymphocytes, we have
Extrinsic
the
pathway of
activation
apoptosis.
of this extrinsic pathway of apoptosis. And we have some regulatory T lymphocytes. These regulatory T lymphocytes suppress the immune responses of both T and B cells. So we have activation of the immune system, and there should be some cells that suppress the immune system. Yes. Okay. You know that we have two different types of lymphocytes, T lymphocytes and B lymphocytes. What's the difference between these two types of lymphocytes in the place of their maturation?
Origin of maturation.
Yes, the place they mature. About B lymphocytes is bone marrow and T thymus. Yes, exactly. And for each type of antigen, we have a clone of T or B lymphocytes. What do I mean by a clone?
A series that all know this pathogen.
The same antigen.
Same
Yes. All the lymphocytes in one clone recognize one antigen. Okay? So when I say a clone of lymphocytes, I mean that all of them are the same, and all of them recognize one type of antigen. So, for example, in neoplasms, we have monoclonality or polyclonality. In neoplasms, for example, lymphoma, do we have monoclonality? Yes, exactly. In neoplasms, we have monoclonality. Because in all neoplasms, we have just one clone that starts to grow without any inhibitory factors, and we have monoclonality in neoplasms. And and after we have maturation of lymphocytes in bone marrow and thymus, where do they go? They go to secondary lymphoid organs. For example,
lymph nodes.
yes, exactly. And what do they do there?
Recirculation.
Yes, when they go to the secondary lymphoid organs, Why do they go there?
Counter antigen.
Yes, because they, they should see the antigen there, and before they, become familiar with the antigen, they are naive lymphocyte. They are inactive, and after that, they become activated. So they go to the, secondary lymphoid organs, and there we have, after confronting the antigen, first we have naive lymphocytes,
Effector.
and what is the, naive lymphocytes? What do I mean by naive?
Before maturation.
No, not before maturation. It is mature,
But
but
no, they didn't recognize the antigen yet.
yes, yes. It is mature. It has receptor for the antigen, but it has not met the antigen yet. And after meeting the antigen, it becomes effector and
When it binds to the antigen and starts function.
sorry.
When it binds to the antigen and starts function.
Yes, yes. And after, it gains its function, for example, it produces cytokines, or for example, about B cells, antibodies. What happens after that?
Memory.
Yes, we have some memory cells, and, the regulatory cells suppress the immune response. Okay? So we have only memory cells which are remain, and in the second, entrance of that antigen to the lymph node or to the body, we have a more rapid reaction against that antigen. So some of you, in summary, tell me about naive lymphocytes, effector, and memory lymphocytes. No?
They are mature.
Naive lymphocyte, it's the mature lymphocyte before recognizing an antigen. It's ready, but it hasn't met an antigen yet. The effector lymphocyte, it's after the recognition and during the function. The memory lymphocyte, it's the lymphocyte when it has recognized it and it's ready to act on it.
So the effector lymphocytes are happening after the clonal selection.
Exactly. First, when they are matured, they have a specific receptor for the antigen, and after they, meet the antigen, the clonal expansion occurs, and after that, we have, activation of this.
So you're saying naive lymphocytes don't have this receptor?
Yes, they have.
They have, but not like this.
Yes, exactly. They have the receptor, but they have not met the antigen. Only the receptor.
I see. And after clonal selection, that receptor will be active.
Yes, it becomes activated, and after that we have memory cells.
And this clonal selection should be negative.
I don't understand.
Clonal selection should be negative. Negative or positive.
Oh, yes. Positive in what we are talking about now, because we are talking about infections. Negative for, not, infectious antigens, for self antigens. And we will talk about it in the next session. Because about self antigens, our lymphocytes should not be active against self antigen. And that's what, our body does in negative selection. The lymphocytes that recognize self-antigens should die by apoptosis.
So
And that
that's
is
why we-
negative selection. Positive selection for the antigens that we want our body to respond against, for example, infectious antigens. But for self-antigens, we have negative selection.
I see.
Okay, about T lymphocytes. Most of the lymphocytes that we have in peripheral blood are T lymphocytes. 60 to 70% are T lymphocytes. We also have T lymphocytes in spleen and lymph node. You know, in spleen and lymph node, we have special sites for T lymphocytes and B lymphocytes. Yeah? Yes, exactly. For example, in lymph nodes, interfollicular zone. Okay? In follicles, we mostly have B lymphocytes. In interfollicular zone, T lymphocytes. And are they able to recognize the free or circulating antigens? No. Because the antigen should be processed and, you know, yes, the antigen presenting cell should present the antigen to the T cells, okay? And, you know, we have, as I told you, T helper cells and T cytotoxic cells, and also we have regulatory T cells. We talked about these. And, you know, helper T cells, which have CD4 on their surface, you know, they recognize antigens that are presented to them by MHC class 2. But CD8 positive T cells, MHC class 1, yes.
Professor, there is a mutation in CD4, like HIV. He won't able to make a inflammation at all, right?
You know, this part of inflammation, you know, this part of immune system is impaired.
So no inflammation.
We cannot say that we have no inflammation, but you know, because they are T helper cells, they are important in, you know, both innate immunity, macrophages, and also for activation of B cells. So we have reduced immunity, but we cannot say that no immunity. No. But you have impaired function, you know, severely impaired function of immune system.
Doctor, may we have a break? May we have a break?
Oh. Sorry, too soon. Okay, let me finish this part, and after that, we're tired.
When you wake up at 7:30, you'll feel tired.
Okay. Okay. And you know, here you see the structure of what? MHC and T cell receptor. Yes? T cell receptor. You know, this is a CD4 positive T cell. You have, you know, T cell receptor here, and you see that we have presentation of the antigen by MHC class 2. And you know, just binding of antigen to the T cell receptor is not enough for the immune response. Okay? We have some molecules that help the T cell receptor, and we have two signals here. We see with we have CD28, and it binds with CD80 or 86, the B7 molecules, and we have CD4, which attaches the MHC molecule. So these are all important in
Fixation
activation.
of the
Yes, yes. And here we have the B cell. About B cell, what is the receptor?
antibodies.
Antibodies. Which types of antibodies? IG, N, and IgD. Yes, they are the types of antibodies that are B cell receptor. And here, do we have any presenting cell? No, that's why we say that B cells can recognize, free antigens. Yes. So here again we have the receptor which attaches the antigen, and again we have some helper molecules. Okay? And I told you about the action of helper and cytotoxic and regulatory T cells. And okay, you can have a break. And after 10 minutes,
Professor, the slide before it, you have to memorize it or just for finish?
the what? The cytokine?
No, the slide before that one. We have to memorize every single one or?
Yes.
Yes?
Yes.
Gosh.
This one,
Yeah.
you know, the parts that are important is, you know, this molecule and the T cell receptor.
So we have to memorize this one and this one?
No.
Is that this one?
I don't memorize them. Yeah.
Because of that professor, we don't get.
No. This one.
This one and this one?
CD4, you know that because it's CD4 positive T cell. You should only know that the CD4 is important in this interaction.
I see. And we have to memorize CD28 and what?
T cell receptor, CD20, CD4.
And what is this
And
one?
you know, they are, you know, some parts of CD3.
So
CD3 is also important in this signal transduction. But they are not that
what do you mean
important.
by for example signal?
I will talk about it later.
Talk about it now.
It's
We have a
very important.
We have a list, so we have a time. So first we have the activation of the first signal. First signal give it to the second signal?
No, they are different. You know, by, for example, innate immune system activation, we have expression of CD8T or CD86 in, on the surface of antigen-presenting cells, by microbes, for example. And you know, these two should attach so that the production of cytokines, for example, occurs.
So just for in case of pathology we have the second signal, but in normal case we don't have a second signal, right?
In what case we don't have
Like for inflammation.
inflammation? No, in inflammation we do not have CD4 positive T cells.
Right, we don't have it. In which case?
Yeah.
So in which case we have just the first signal? Or we have all, okay, all of the cells.
Yes, most of them are important.
You have to go for.
Acting against, yeah.
And what's the difference between these two?
Oh, you know about the signaling inside the cell. You know, I don't know the details, and it's not important for you. You should ask immunologists, because what happens exactly in the cell. The thing that I know is that they are important in translation of proteins that proteins that are cytokines. You know.
Twist and start? Twist and start?
I don't understand.
Twist and start? TWIST?
Yes, for example, I the exact genes I don't know, but I know that, the thing that they do is, translation of genes and production of cytokines. Twist and stat. Let's go. We have
My name is not in the list. Can I write it here? Thank you.
twist.
Thank you, bro.
Twist, I know about, I twist in neoplasia is important, but here I don't. Can you write it here for me?
ChatGPT.
Oh, ChatGPT. Please then instead. That's a good idea.
Because that would be hard for me.
Yeah. You know, for opening ChatGPT, you know,
Yeah, but then
yeah, and no,
okay, next time
oh, okay. You search it and tell me.
I'll do that for sure.
That's that has a point for.
Teacher همش خیلی همینجوری زده همش از
فارسی حرف میزنی. خب ببین اگه همتون بلدی.